VA ends abortion services. What it means for veterans. Imagine the shock and frustration felt by veterans and their families when they learned that the Veterans Affairs VA department has decided to halt all abortion services at its medical facilities. This move, announced on Monday, has sparked a heated debate about the role of federal healthcare providers in reproductive health services. VA officials have labeled the policies that allowed these services as legally questionable and unnecessary, effectively revoking the authority of VA physicians to perform abortions on federal property, even in states where abortion is outlawed. This decision means that veterans seeking abortions will now have to seek this medical care outside the VA system. But here's where it gets controversial. The VA's new interim rule has been met with both praise and criticism, with advocates for abortion rights decrying it as an attack on critical medical options for veterans and their families. The VA's decision to end abortion services at its facilities comes after the Supreme Court's landmark ruling in June 2022, which overturned Roe v. Wade. This ruling legalized abortion nationwide, but since then, 20 states have outlawed or severely restricted abortion services. This has prompted a national debate over federal departments' responsibilities and limits in regards to reproductive health services for women veterans. The rule has been in the works since late July, but has not been publicized by department leaders or White House officials. Per federal regulations, the proposal will now undergo public comment and additional review before becoming permanent policy. But it is essentially already being enforced within the department. This impacts individuals using both VA healthcare services and the civilian health and medical program of the Department of Veterans Affairs. Abortion rights advocates have been vocal in their opposition to this move. Skye Perryman, president and CEO of Democracy Forward, stated, "This proposed rule is a smack in the face to those who have served our country and their loved ones, stripping pregnant women of their bodily autonomy and restricting their access to abortion." Nancy Northup, president and CEO at the Center for Reproductive Rights, echoed this sentiment, saying, "After veterans put their lives on the line to protect our freedoms, the Trump administration is trying to rob them of their own freedoms and putting their health at risk." Democratic lawmakers have also voiced their concerns. Senator Patty Murray, D. Wash, and a member of the Senate Veterans Affairs Committee, said, "The bottom line is Republicans don't care if your health is in danger, if you're a veteran, or if you've been raped. They want abortion outlawed everywhere, in every circumstance, for everyone." But Republican lawmakers have praised the move, accusing President Joe Biden's administration of overreach with the changes made 3 years ago. A group of 6 House lawmakers, led by House Veterans Affairs Committee Chairman Mike Bost, R. Illinois, stated, "Taxpayers do not want their hard-earned money spent on paying for abortions, and VA's sole focus should always be providing service-connected health care and benefits to the veterans they serve." In their Federal Register filing, VA leaders clarified that the change will not prevent physicians from providing life-saving care in cases of ectopic pregnancies or miscarriages, since other provisions within the law already mandate those protections. They also pushed back on the presumed demand for abortion services within the veterans community. Department statistics show that roughly 100 veterans and 40 CHAMP VA beneficiaries have received abortions through VA medical centers annually since the policy change in 2022. But Senate Veterans Affairs Committee Ranking Member Richard Blumenthal, D-Con, noted in his criticism of the rule change that nearly 500,000 women veterans of reproductive age are enrolled in VA healthcare, with more than half of them living in states with abortion restrictions. We cannot let VA stop providing this care to veterans by ripping away this narrow, targeted protection, he said in a statement. I will be fighting as hard and long as possible to reverse this cruel, dangerous new policy. The public comment period on the new rule change is open until September 5th. Leo covers Congress, Veterans Affairs, and the White House for Military Times. He has covered Washington, D.C. since 2004, focusing on military personnel and veterans policies. His work has earned numerous honors, including a 2009 Polk Award, a 2010 National Headliner Award, the IAVA Leadership in Journalism Award, and the VFW News Media Award. And this is the part most people miss. The debate over abortion services in VA facilities raises fundamental questions about the balance between federal health care responsibilities and state laws. Should federal health care providers be bound by state laws, or should they operate under a different set of guidelines to ensure comprehensive care for all veterans? What do you think? Should the VA be providing abortion services, or should this responsibility fall solely on state-level healthcare providers? Let us know your thoughts in the comments below.